It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Well, folks, we want to keep you healthy. We want to keep the women healthy. We want to keep our young kids healthy. And today's a great show to learn a lot about how we can stay healthy, especially in the young, with our babies. And we're going to talk about breastfeeding today. Very, very important, folks. My guest today, a good friend of mine, Dr. James Caggiano, has been around since 1981 with the Greater Hazleton Health Alliance. Folks, I'm telling you, you will have to just Google our doctors here and you'll find out that we have top shelf here in northeastern Pennsylvania, for that matter in the state. And joining me also is a registered certified lactation counselor, Courtney Munline, and we'll be talking to Courtney rather soon. The good doctor, how are you?
Good, Sam. Good to be here.
Busy, huh?
Yeah. Good to be busy.
Why do these kids keep getting sick, doctor? What's wrong? Can't we keep these kids healthy? Keep getting sick, doctor. I guess prevention is always the best route to go, right?
Absolutely.
So take me from, for those people who have newborns or whatever, as a certified pediatrician, what are some of the general things to keep, our children healthy? Okay, I know they have to go for their checkups, and that's another thing. When do they go for their checkups, and then what we're seeing?
Okay, the biggest advance in medical care in the last, pick a number, is vaccination, because now we can prevent really, really serious disease, lethal disease. So vaccination is the most important tool in the physician's kit in terms of prevention of disease in pediatrics. The schedule with which we see newborns is really geared to both making sure that they're doing well at important points in time, but also to make sure that their immunizations are given appropriately and on time. The schedule is designed to administer vaccines at the time that they are, number one, most effective, but also when the youngster is most susceptible to those diseases.
And what would that be now?
Well, the big one that we hear about so much lately has been whooping cough. The whooping cough or pertussis is a respiratory illness. We recently, 1993, I guess that's recently for an old guy, changed.
Speak for yourself. Okay.
Whooping cough vaccines. The original vaccine was very potent but had some side effects. You could pretty much, by the time the youngster had the third dose of vaccine, he or she would get fever. There were some other side effects. The vaccine was reformulated in 1993. It is not as aggressive of a vaccine. It has fewer side effects, but what we're finding is that it's not persisting in people's bloodstream as long as the original vaccine did. And so with a combination of older people, senior citizens in particular, having their whooping cough immunity decrease with age, and the fact that we don't think that the immunity that was conferred by the new vaccine lasts as long, we're starting to see some whooping cough in various places around the country.
So when is the first time you get, there's a medicine for, when was the first time?
The first dose of whooping cough is given at 2 months of age.
Is that right?
Yeah. The problem is that vaccinating against whooping cough really requires that the child have 3 doses of vaccine before the protection is in place. Unfortunately, infancy is when kids are most susceptible, when it can cause the most damage.
How is this something that comes from, cold weather, or I don't know, not proper diet, or I mean, how does this?
Whooping cough is a very straightforward bacterial disease.
Okay.
There is a germ, Bordetella pertussis, that causes it. It is passed from person to person. The real problem with whooping cough is that when you first get it, it looks like a cold. You get a plain old watery runny nose. The nasal congestion stays clear the whole time. There's no color change. There's none of that sort of stuff. When they're sick in the beginning, they usually don't have much in the way of fever. That lasts for about 2 weeks' time. The second phase commences when people start to get this cough, and the cough is a very particular kind of cough. It doesn't sound like anything else out there, and that so-called paroxysmal phase, because it's called a paroxysmal cough, is really a vigorous cough. You might not know what it is, but you get your kid to the doctor just because of how severe the cough is. And then after that, kids recuperate, whether they're treated or not, if they don't have some complication from the earlier phases. The problem with whooping cough is that it's very susceptible to antibiotic, but only in the first 2 weeks when it looks like a cold. By the time the cough comes, it's too late to treat it. So that's why the strategy that's been employed worldwide has been to prevent this rather than to try to treat
And
it.
so what do they do then? Which means as soon as they see something, a cold or something?
Well, what happens is that we have to be very, very suspicious of children who have colds, but who have had any exposure to whooping cough. In other words, every kid who comes in to see us, we're not concerned about whooping cough per se, but if there's any history of someone in the household who's had an unusual cough or an unusually persistent cough, that's what gets your
Okay, so here's what I want to
board
ask.
lit up.
Yeah, and everyone's so happy to have their babies, okay? And sometimes, I see some people, and I say, how beautiful little babies, and how old is your baby? She's 3 weeks old, or she's a month old, and they're in the supermarket, okay?
Right.
With all due respect, I mean,
Excellent.
but the point is, is really that a good? Is that a good thing? I mean, around times when people are coughing,
Traditionally, we tell parents, look, you really don't want these kids around a lot of people. And so what I'll tell them is, you know what? If there's a big family party, an anniversary, a wedding, something like that, stay home. Tell them Dr. Caggiano said you should stay home. Blame me. If Aunt Philomena gets upset, she can come up and punch me in the nose. I don't care. It's for the baby's benefit.
Yes.
The problem is that, especially at a family gathering, the baby gets passed around. And you can't tell Aunt Philomena that she can't kiss the kid, even though she's got a runny nose and she says it's, quote, allergies.
Yeah.
So you're really better off staying home.
Well, how about going to these places? I mean, the supermarket.
Well, I think that, again, we tell parents, look, it's perfectly okay for the kid to take a spin around the block, in September or October when the weather's fair and the baby's appropriately dressed, and he's not going to have exposure to other people. It's not being outside that causes the problem. It's, as you suggested, the exposure to other people.
Yeah, and I've seen, and they're babies. I mean, being an Italian, when you see a baby, you want to squeeze the cheeks, you want to kiss the baby, you want to hug them, when you do. But I mean, I try not. I'm so proud and just so happy to have the child. Okay, and they want to show it off, but when you have these kind of everyone who you don't know who you're dealing with, and you get those things. Yeah. So I think prevention is so good in that case. But I guess if you see your child, now you're saying 2 months, right? As well. Whooping cough comes to older people too, right?
Sure.
And how is it generally in the younger babies?
Well, the thing is that if the youngster is adequately immunized, then the risk of whooping cough is about zero. Okay, it's only when, for whatever reason, the youngster doesn't get immunized, or the immunization has started, but they're not through the whole series, that they're at risk. So particularly, we find that a high-risk group, of course, are babies who were born prematurely. They typically are not very strong, depending on how early they were delivered. We don't delay when they get their whooping cough vaccine because of prematurity. They still get it. If the baby is a month early, they still get the first dose of whooping cough vaccine when they're 2 months old. But the problem is 6 months is a long period of time. It's a big window for the kid to be at risk.
So you're saying, I guess after you have a baby, the very first time you bring a baby to a pediatrician is 2 months?
Well, what happens is that's when the first vaccination is given. We see Obstetrical, what we call obstetrical length of stay, the length of time that moms stay in the hospital after they deliver babies, has gotten shorter.
Very short.
In Pennsylvania, you can't by law compel a mom to leave the hospital before she is 48 hours from her delivery. Some moms who already have one child at home and kind of know the ropes and have other responsibilities at home will ask to be discharged home at 24 hours. And to accommodate them, we make sure that they have all their healthcare knowledge kind of up to date.
Is that good or bad, though, doctor?
I think that it's like anything else, Sam. It's a compromise. If you've got two other kids at home.
Yeah, but for the health of the child, is it better that you do what you think is best for the child?
Well, we do what we think is best for the child, because then and that's what I'd started to get to, and I'm sorry that I'm taking the long way around.
Okay.
Is that when the babies, because they go home so young, we always see them 48 hours after they go home. So in the past, when I first started, babies were in the hospital after a vaginal delivery 4 days.
Yeah.
Moms were postpartum from a C-section for a whole week. Well, by that time, you got a chance to observe the baby. The baby was gaining weight. Everything was fine. Didn't matter that you didn't see him for a couple of weeks. Now, the standard of care is that you need to see these kids within 48 hours of when they're discharged home. And so that's what we do. And in our practice, every baby who comes to the office for what we call a weight check is seen by one of the physicians. We weigh and measure the baby. We make sure that they're not jaundiced. If the baby's a little boy and he's been circumcised, we check his circumcision. But the baby gets a full exam by the pediatrician at that point, because we want to see that nothing has changed since the time the mom was sent home.
Now, you said, are we seeing an increase in whooping cough?
I think that nationwide we're seeing an increase in whooping cough. We've not seen outbreaks in our own community. Fortunately, people have been very responsive and responsible about getting their youngsters immunized. When it's only when children don't get immunized that the risk of getting an outbreak can get started. Once the percentage of people immunized in a population dips below about 90%, then there are enough people in any population that are susceptible to that disease that they can pass it to each other and get an outbreak going.
Okay, now passing to each other, is it possible for a parent or an adult to get whooping cough from a child?
It's possible if the adult's immunity has decreased over time. In fact, that's usually not what happens, though. What usually happens is a caretaker, an adult caretaker, in particular grandparents, who haven't seen whooping cough for a long time. They got their immunization when we did when we were little. There's not so much whooping cough in the general population that people are getting exposed to it frequently, and so people's immunity doesn't get bumped up. The great thing about, for example, chickenpox, before the vaccine happened, was that there was enough chickenpox around all the time that after you got your vaccine initially, or after you got the chickenpox initially, the old-fashioned way, every once in a while you get exposed to somebody who had it, and your immunity, even though you never got the chickenpox again, your immunity would get bumped up a little bit. Well, once we wipe or do a better job about wiping a virus or a bacteria out of a population, then one of the downsides, it happens, nobody plans it, is that you don't get exposed to it over and over again. And so that little bump up in immunity that you would get every few years from being in contact with, oh yeah, my grandson got chickenpox. Well, yeah, that improved your immunity because, now the last couple of cases of chickenpox that I've seen were kids who were 4 years old, back when we weren't giving a second dose of chickenpox vaccine before kindergarten. These were 4-year-olds, both of whom 6 months apart happened to be exposed to a grandparent with shingles.
Is that right? Wow. Folks, I'm talking to Dr. Caggiano from the Greater Hazleton Health Alliance, and his phone number is 501-6400. We come back. What about breastfeeding, folks? We hear pros and cons. It's a good thing. It's a bad thing, okay? And we're going to find out from a person who is a professional certified in that particular area. Courtney Medline when we come back after the break. Stay with us. Welcome back to the Sam Lesante Show, folks. We're learning a lot today about young children, and we have my guest, Dr. James Caggiano, and you can get in touch with him at 570-501-6400. And remember, 24/7, folks, any show you want to know about, especially our health shows, it's ssptv.com. My email is sam@ssptv.com. Now we're going to talk to Courtney Medline. Am I saying that right, Medline? Who is a registered nurse, certified lactation counselor at the Hazleton General Hospital's Family Birthing Center, which is fabulous up there. It's beautiful. It really is. They did a great job up there. Just fabulous. Now, Courtney, let's talk about first of all, what is a certified lactation counselor?
A certified lactation counselor is somebody who wants to assist and help the mother in breastfeeding. You take a specialized course in it, 16-hour course. I took it through PCE, which was administered through Geisinger. Now I'm certified in helping lactating moms with different concerns they have and problems in getting the baby to start breastfeeding with the latch.
Now, wait a minute. You tell me you have to go and learn how to breastfeed your child? I mean, I remember back in the old days when they just, boom.
Right, it is natural. It's very instinctive. This is for a professional, healthcare professional, to help the mothers.
And I guess that's very important. Okay. Now tell me, okay, how important, okay, because there's pros and cons here about this, okay, how important is breastfeeding to an infant's health, and what benefits does the infant have and the mother receive from breastfeeding?
There are a lot of different benefits that go to both the mother and the baby. For the baby, there's a less risk of coming down with infections such as ear infections, which a lot of babies get, respiratory infections and illnesses, making less sick days for the baby, so less sick days for mom. It's less of a chance of childhood obesity and obesity later in life. And
Get out of here.
And also chronic diseases such as diabetes.
Okay. I don't mean to interrupt you, because when you get a certain age, you start forgetting a couple things. That's why I'm going to go to Dr. Caggiano. He's going to help me out with this. How do you know if a mother is healthy enough to breastfeed? Okay, when you're saying they get all these nutrients, etc. And what about the mother's diet? Are those things important?
Well, you know, Sam, you said there's pros and cons to breastfeeding.
Yeah.
There's no cons to breastfeeding. There's some times when a mom shouldn't breastfeed. If she's HIV positive, she shouldn't breastfeed. And she can't breastfeed if she's taking a small number of harmful medications that, while she may need them, could cross into the breast milk. But apart from that, there are no cons to breastfeeding. In studies that were done on women who underwent severe privation during the Second World War, where there wasn't much food around, they were still able to successfully breastfeed their moms. So Mother Nature's provided this method of nourishing babies that even if the mother isn't getting what she necessarily needs, she's going to be able to nourish her baby. Now, she may not do as good a job. It may be harder for her if she's undernourished, but the species is wired in a way that this is going to work, and so our job as professionals is to smooth over all the little, well, let's use a Hazleton metaphor, potholes in the road to make the job easier.
Take me through, what was it, now, how soon do I have to be involved with you, you know, before I have the baby? Or
any education before you have the baby would be great. We do offer prenatal classes at Hazleton General for before you deliver the baby. We go through a breastfeeding class, or anything that they could find online from reputable sources would help.
So, all right, I have the baby, and you know I'm not breastfeeding. However, maybe a month or 2 months later, I decide can I breastfeed even after maybe 2 months or 3 months later.
The longer you wait to get started, the harder the process is to establish. So what we try to preach to parents, and what we try to practice in our birthing center, is that from the moment that the baby emerges from the mother, we want that baby, as we say, skin to skin in contact with the mother's chest wall. And if you've ever watched any of the really helpful videos that the La Leche League and other people put out, if you put a baby on its mother's abdomen, it will physically make motions to get itself to the breast.
No kidding.
Absolutely.
And so you educate the women how to breastfeed, right? And what are some of the things that women should know?
Well, within the first hour after they give birth, we like to put the baby, as Dr. Caggiano said, skin to skin, and just initiate breastfeeding. That will lead to a successful breastfeeding relationship with the mother and baby. Throughout the stay at the hospital, the postpartum stay, I'll be in, or my partner, who also is a certified lactation counselor, will be in to make rounds to assess how the baby is latching on and how the baby is suckling, and just to make sure that the baby's getting the correct positioning for a successful relationship.
Can I assume that everyone who gives birth can breastfeed?
Actually, 99% of women can breastfeed. There's only that small 1% who, physically cannot breastfeed.
Doesn't make any difference the size of the breast?
No, that does not.
Okay, I'm just asking.
Right.
What are some of the other common questions that women would ask you about breastfeeding?
Is it painful?
Yeah.
It's not supposed to be painful. If you have pain, it could mean that you have the incorrect latch. So you might have a pressure or tugging sensation, but it should not be painful for you.
So you educate women, and they should know this before they have the baby.
They could, yeah.
What other things in the family birthing center do you teach about up there?
Well, we educate our staff, so all of our nurses are educated in breastfeeding. So because you could have a baby at any time, they could help the mother assist with breastfeeding.
So this is important, doctor, huh?
This is one of the best things, the most important decisions a mom can make to have a long-term positive outcome for her baby. Wow. I think that there are some other concerns that moms have. It takes a period of time for a mom to experience what's called engorgement, the feeling of fullness in the breast. Most moms will tell us, yeah, when the baby's born, my breasts sort of feel like the tip of my nose. They're harder than normal, but they're not really hard. When the breast milk comes in, moms will say, oh yeah, now it feels like my forehead. I joke with moms all the time. Yeah, before the baby was born, you couldn't sleep on your belly because the baby was in the way, and then the baby delivers and you figure, okay, now I'm going to sleep on my belly. That's where I'm comfortable sleeping. And your milk comes in and boom, you're on your back again because you're full.
Very quickly. Thank you, Courtney. I appreciate that. But I want to talk just briefly about 2 minutes on SIDS.
Okay.
Let's talk about that.
Okay, so sudden infant death syndrome was originally described in the early 1970s. And basically, it's a situation where babies, for previously unexplained reasons, died without warning. There are a small number of children who have a congenital metabolic disorder that can cause that to happen. They're the vast minority. The big insight came when studies were done in Australia and New Zealand showing that if you had the baby sleep on their back rather than on their tummy, the risk of suffocation immediately was cut in half. And so now we use a protocol called Back to Sleep, where we encourage moms to have their baby sleep on their back rather than on their tummy, and that seems to make a huge difference.
Now, what about blankets in the cribs and stuff?
Anything that could potentially interfere with airflow through the baby's nose could be a problem, and so we encourage moms to not use blankets or pillows or anything like that in the crib, and that as the weather gets cooler, if they want to bundle the baby up, they should have the baby wear an increasingly heavy blanket sleeper, for example, or heavier pajamas rather than using a blanket.
Is it best to have, what would be the perfect, well, nothing's perfect, but what would be the correct temperature for the room of a baby?
We generally tell parents that they just need to be comfortable. I usually tell parents that 68 degrees is really perfectly fine.
Perfect?
Yeah.
Courtney, thanks for coming on the show. Okay, I can't help you out with breastfeeding, but I know a lot of women. I know my grandmothers and my aunts all breastfed. That's why we're so healthy today, right, doctor? You know, did your mom breastfeed?
Yeah.
You see, that was come natural. But birthing is so important, and to get the education that you need. Doctor, it's always nice seeing you.
My pleasure,
Your
Sam,
daughter's
as
doing
always.
all right?
She's doing fine.
That's
Thank you.
good. Folks, if you'd like to get in touch with Courtney, her number is 570-501-4200. Okay, and Dr. Caggiano is 570-501-6400. And remember, folks, I'm telling you right now, no need at all to leave our area. We're so proud of our doctors and our nurses and all the people who work in the hospitals. Remember, all those nurses and assistant nurses and people who are in the hospitals, they're trying every day their best. I know sometimes some of you get a little frustrated, but remember, they're doing the best that they can. Give them some help. They need all the help they can get. Doctor, thanks again for coming on the show.
pleasure,
Courtney, thanks for coming on the show. We'll see you next time.